Greetings, everybody. Chris Hislop from the Montana World Affairs Council. This is What, So What, Now What, the International Affairs webcast that brings you a key issue of the day, connects you with an expert, and in just 5 hot minutes, you become the expert. We're doing a series of What, So What, Now What this week with the International Development Studies program at the University of Montana, whose students are helping us better understand the key issues of the day. And in keeping with that, I'm very happy to welcome Isabella Chambers. Isabella, how are you doing?
I'm doing well. How are you?
I'm very well. It's great to have you on the show. Now, we hear day in and day out, and we read on the newspaper about the CDC and a global health agenda. I wonder if you could tell our viewers a little bit more about that.
Yeah, of course. So, I, like probably many people my age, didn't even know what the CDC was a few years ago until COVID-19 hit. And then suddenly, like you said, we were seeing it all over the place on the newspaper, on news. People were talking about it all the time. And suddenly it seemed like a very important thing that was very prominent in our lives. So, the CDC basically stands for the Center for Disease Control and Prevention. And it's basically a global effort to strengthen the world's ability to keep Americans healthy and keep the globe healthy through safety and health. And and their kind of like motto is to to keep the globe healthy by reducing morbidity and mortality. So I think that means that in the long scope of the world, like people getting very obese was a really large concern. But more recently, the CDC has been their biggest priority is the COVID-19 virus. And basically, what the CDC is, like who runs it, it's a group of scientists, lawyers, administration people, and they are constantly researching and discovering things about that could possibly affect populations in negative ways, which is like a serious thing that everyone, like the population, is very into that these days because of the COVID-19 virus. And they work on discovering these things and putting out into the public so the public can know what to do. Um, so the first case of COVID-19 was found in America 698 days ago. So it's
Wow.
been almost 2 years. And but still people are confused. Still people are questioning, still people don't quite know what to do or when this will end, and it's all a big concern. So the CDC is just working on easing people's concerns and giving out the correct knowledge because there's so much misinformation from the
Right.
media, and everyone can go on the internet and just search so many things and get so
I
many
see.
different answers. So they are there to really give the correct information and make sure people know what to do.
Well, that's really interesting, Isabella. Thanks for kind of zeroing us in on what this thing is. Now, as you say, I mean, there's some disagreement in America and around the world as to why this matters and what the CDC does, if it's good or bad. But, in your opinion, maybe you could share with us a little bit of, why does the CDC and its work matter to us here in Montana, to us here in the United States and around the world?
Yeah. So, specifically in Montana, I think that our state is really run by, it's well known for its beauty, for its recreation, um, for things like that. And as we saw when the whole country got locked down, like small store owners suffered, ranchers suffered, just the economy really suffered from people not being out and about. And so, specifically in Montana, it's important that people know what the CDC is directing because they have this really clear knowledge, or at least from what they know, to tell us what to do. And so, we need to pay attention to that because if we don't, then unfortunately, it will really hurt our economy, hurt like ski resorts won't be able to open. Um, Little mom and pop shops downtown will start closing down. The restaurant industry is can go into distress, and there can also become a job crisis because people are afraid to go out and work. because of that fear of getting infected if there's high rates in the area that you live. So, and that's kind of the case it is in the whole country and the world as well. But also, like international exchange, if people don't pay attention to what the CDC is saying, then the virus will get bigger and bigger, and people won't be able to travel. When there were when presidents and leaders of countries were putting like travel restrictions, that caused a lot of disruption in people's lives and just in the commerce of the world. Gas prices got screwed up, things like that. So it can
Right.
really have a ripple effect through all sorts of things.
Yeah, indeed it can. I mean, as every single person on planet Earth has seen over the past couple of years. And so I hear you when you say that the CDC is here, as a way to give us guidance, to give us information about, what is happening and how to react to that. Um, and this has been, of course, a very difficult issue for all of us. But if you were to look ahead in the near future, are we expecting anything more or different from the CDC and the global health agenda? Is there anything coming our way?
Well, there recently on like November 23rd, I think it was, there was a new variant of the COVID-19 virus detected in South Africa called the Omicron, I believe. And so in the near future, unfortunately, there is another possible wave coming towards us. And the CDC continuously says that they're doing as much as they can to learn about this, but truly, we're all learning about it as it comes, and they don't really know. So, unfortunately, the things that we've been hearing about for the past 2 years is still a thing on our minds, like get vaccinated, wear a mask, social distance, avoid crowds, wash your hands. The things that are all being nailed into our brains every day. But hopefully, in the distant future, this will become just like the flu, or like when it becomes winter time, you kind of expect to get a little cold. So hopefully that will humans will just adapt and take this virus into our genes and just
Right.
learn how to live with it.
Yeah, well, I mean, it's been a very challenging time, as you say, here in Montana, particularly for our business people, our farmers, our ranchers, and those engaged in, in business and in industry and in education and what have you not. So, but I'm optimistic with you that maybe we will get around this corner and whatever that may be. But I'm glad to know that we have the CDC and others that can give us this kind of information. So, Isabella, thanks a lot for helping us better understand the CDC and the global health agenda. Let me also thank quickly our very generous sponsors, the Dennis and Phyllis in Washington Foundation, Allegiance, and Stockman Bank. They help us bring this and many other programs to you on international affairs. And special thanks to those viewers who are preparing for Academic World Quest. That's a program sponsored by the Montana World Affairs Council that brings hundreds of the best and brightest Montana students together to talk about international affairs. So, Isabella, thank you once again. Thanks to our sponsors, and thank you all for watching. Have a good day, and bye-bye.